Welcome back. It is 6:27. May is Mental Health Awareness Month, and CBS 19 is tackling multiple topics to give East Texans the resources to grow. Accessing mental health care can be a challenge anywhere, but in rural areas of the Piney Woods, it's an even bigger struggle. CBS 19's Ayana Aird shares how organizations are working to close the gap and create safe spaces for healing in the process.
This room is the Amp Up Your Mood room. This is where we have music therapy. It's a silent disco room.
Christy Copeland is a licensed professional counselor and founder of Copeland Center.
This room is called the Express Yourself. This is coping through art and creativity.
She's been running her private practice in Longview since 2019.
It's important that everybody has an outlet. There's so many things that we go through. I want it to be that outlet and that safe space for other people.
Christy says many of her clients struggle to find accessible mental health care in East Texas.
Countless number of times received calls and said, wow, I'm so glad you were able to take me because I wasn't able to get in, anywhere else. And so that there's also like waiting lists,
She believes the lack of access is even more severe for marginalized groups and younger patients.
And there's not a lot of diversity with the mental health professionals. There is a shortage of providers for children and adolescents as well. We don't have an inpatient facility here for children and adolescents all the way up to age 49.
Dr. Evan Doval with Greater Longview United Way says rural areas like East Texas face the greatest disconnect from mental health services.
If you look at our community and look at our area now, that there are gaps in people's services. There's holes in our social safety nets that people are slipping through. And so for us, we want to be that bridge builder to bridge the gap for people. So to help connect them to where they are, to where they need to be. So whether that's providing resources or counseling or programmatic funding or direct donations and gifts.
Dr. Doval says 44% of Gregg County residents live at or below the poverty line, and without healthcare access, that stress only grows.
And in 2024 in Texas, they passed a law that licensed professional counselors can now accept Medicare. So that's another way that people can receive those services. And then you have your local community clinics who generally provide a sliding scale. And most people don't know that. So they can get in and receive mental health services, and it's income-based.
Christy encourages people to check with insurance providers, employers for EAP programs, community clinics, or directories like Psychology Today to find support.
I want people to not be afraid to get help. Not be afraid to talk, to not be afraid to express what's going on, and so that we can get rid of that stigma.
In Longview, I'm Ayana Aird, CBS 19.